Okay, so today we are going to do some testing, drawing blood so we can take blood to the regional lab for testing. I don't know if you can see her eye is very swollen. We don't have snotty noses, but we have had snotty noses in the past. So we're drawing blood on 10 birds to take to the regional lab for testing for Mycoplasma. So you're going to choose the birds that you want. You're going to lay them on their side by gently holding their wings. Have your helper grab their feet and hold their head. Now to draw their blood, you're going to do it from under the wing. I'm using a syringe and a butterfly needle. And then I'm going to transfer it to the vacuum tube. Take their wing back. You may have to pluck some feathers to be able to see the vein. Make sure you pluck in the direction that they grow. And then you'll be able to see the vein in there. I know, baby, you're doing good. Okay, so there, right under the wing, we can see her vein. We're going to clean it with an alcohol swab. It's a thin vein, too. I'm using the butterfly needle. Make sure bevel up. Going to take off the cap there. Bevel side up. You may have to pull the vein tight. Ready? Good girl. And then we're going to slowly pull it into the syringe. I want at least 1 ml. So last year we had snotty noses and a couple with swollen eyes. I gave them antibiotics. I'm getting ready to move. I want to know if they're positive so that if I sell or give them away, I can be honest. I don't want to give them to somebody who's not fully aware of if they're positive for Mycoplasma. I know there are positive flocks out there, so I wouldn't want to give the birds or sell the birds to somebody who does not have a positive flock. So I'm pulling this into the syringe very slowly so I don't break the red blood cells or collapse the vein. So there's 2 ways to test them for Mycoplasma. Cull a bird and take a bird to the regional lab. Ready? We're going to hold pressure on there. Or draw their blood. I chose to draw blood. So I'm going to take my vacuum tube. I'm just going to take the needle, insert it into the stopper, and the vacuum is going to pull the blood in out of the syringe. I'm holding pressure with my thumb where I drew the blood from so that she doesn't get a bruise. Not going to push this into the tube too quickly because once again we don't want the red blood cells to break, which will cause it to be hemolyzed. You're doing a great job, sweetie. All right. Once we get all that blood in there, we're going to cover the needle with the safety shield. And we're going to invert this tube 8 to 10 times. Very gently. so we don't break the red blood cells. And then we're going to lay it on its side on our way to the lab, because they'll get more serum out of it if we lay it on its side to allow it to clot. All right. She looks good. She might have a little bruising there, but she looks good. Okay. She's good to go.